Today my discussion on myasthenia gravis, which is an autoimmune disorder. The name myasthenia gravis, which is Latin and Greek in origin, means grave or serious muscle weakness. It is an autoimmune disease of neuromuscular junction characterized by fluctuating weakness of certain skeletal muscle groups. It is not a brain disorder. Brain functions normally. The disease may be generalized or ocular specific. Now come to the point definition. It is an autoimmune disease in which weakness is caused by circulating antibodies that block the acetylcholine receptor at the postsynaptic neuromuscular junction, inhibiting the excitatory effects of the neurotransmitter throughout the neuromuscular junction. Now, the incidence. Autoimmune myasthenia gravis has a prevalence of approximately 14 to 4 per 1 lakh individual in the United States. So, the 14 to 40% 1 lakh individuals, and the ratio of men and women in adult age is 2:3, and the ratio of men and women in older adult is same. The related anatomy and physiology. In the right side, the nerve sends the acetylcholine, and the acetylcholine receptors are present in the muscles. The acetylcholine easily binds with the acetylcholine receptors and cause the muscle activation. But in the right side, where the autoantibodies covered the acetylcholine receptors, the acetylcholine can't bind with the receptors, so muscle activation is inhibited. The etiology. Myasthenia gravis caused by an autoimmune process in which antibodies attack the acetylcholine receptor site at the neuromuscular junction, and this results in a decreased number of acetylcholine receptors. This prevents acetylcholine molecules from attaching to receptors and stimulating muscle contraction. As it is an autoimmune disorder, the maximum autoimmune disorder caused by results of some medications, smoking, having relative with autoimmune disease, exposure to toxins, obesity, and certain type of infection. Now the pathophysiology. The etiological factors like the medications, obesity, toxins, or infection causes the autoimmune response and the development of autoantibodies, and the autoantibodies attack the acetylcholine receptors and block the acetylcholine receptors and impair the ability of acetylcholine, so decrease the contraction and voluntary muscle weakness occurs. Myasthenia gravis. The clinical manifestations. At first, the muscle weakness, fatigability, dysarthria. Dysarthria means difficulty in speaking. Dysphagia means difficulty in swallowing. And ptosis. And next, diplopia means double vision and nasal sounding of speech. Next, the diagnosis of myasthenia gravis. At first, by physical examination, by muscle strength and tone, coordination, sense of touch, and droopy eyelids means ptosis, and blurry or double vision or diplopia. Next, the blood analysis. We see the elevated level of acetylcholine receptor antibodies. EMG means single fiber electromyography. It considered the most sensitive test for myasthenia gravis, depicts the impaired nerve to muscle transmission. Repetitive nerve stimulation, which repeatedly stimulate a person's nerve with a small pulse of electricity to tire specific muscles. Muscle fibers do not respond as well to repeated electrical stimulation. Now the CT scan, which shows the thymus enlargement, and the anticholinergic test, Hydrofonium chloride is injected intravenously 2 mg at a time to a total 10 mg after injection. Facial muscle weakness and ptosis removal for about 5 minutes. The management. There are three types of management: medical management, surgical management, and nursing management. At first, the medical management, there are some medications like prednisolone, cyclosporin, intravenous immunoglobulin, azathioprine, and neostigmine. Now the surgical management. As because of the presence of thymus gland in the patient with myasthenia appears to enhance the production of acetylcholine receptor antibodies. So removal of thymus gland result in improvement of majority of the patient. There are two types of surgical management: transsternal thymectomy and transcervical thymectomy. In case of the transsternal thymectomy, the most common technique in this open surgical procedure, the incision is made in the skin over the breastbone, means sternum, and the breastbone is divided to expose and remove the thymus gland. And the transcervical thymectomy, in this process, the incision is made across the lower part of the neck, just above the sternum. The doctor removes the thymus through this incision without dividing the sternum. The nursing management. At first assessment, subjective data assess for severity of myasthenia gravis and also assess the patient's coping abilities. And the objective data are respiratory rate and depth, measure the O2 saturation, arterial blood gas, and pulmonary function test, and also measure the strength of all face and limb muscles. Now the nursing diagnosis. Ineffective airway clearance related to intercostal muscle weakness and impaired the cough and gag reflex. Impaired the physical mobility related to voluntary muscle weakness, and the impaired verbal communication related to weakness of larynx, lips, pharynx, and jaw, and the activity intolerance related to fatigability, and disturb the body image related to inability to maintain the usual lifestyle and role responsibilities. Now the planning and goals. Aim to maintain the adequate ventilation, have a return of normal muscle endurance, to maintain the fatigue and avoid complications, and also to maintain a quality of life appropriate to the disease course. Now the interventions. Provide proper ventilation, measure the vital signs, continuing the drug therapy, and provide health education. So the expected outcomes or evaluations are: maintain the optimum muscle function, be free from side effects of drug, not experience the complications, and also maintain a quality of life appropriate to the disease course. Now the health educations. Eat small meals and snacks 5 to 6 times per day, and also avoid eating lemons or toxic waters. Eat warm rather than hot food, and avoid eating chewing or dry crumbly foods. Also alternate sips of liquid to avoid food from sticking. Now the conclusion. As discussed throughout the topic, learning about the myasthenia gravis and its management will help the nurses to care for a myasthenia gravis patient. And nurses can do assessment of a myasthenia gravis patient, classify the level of disease, observe the signs and symptoms, provide the necessary nursing care, and support the patient psychologically.